A very good evening and welcome to all of you to this 27th webinar in our series of Wise Views interactive webinars. We have been holding these webinars each Friday at 6:30 p.m. uninterruptedly, and this is the 27th webinar, and we are lucky to have Mr. Vikram Vuppala, who is the founder and CEO of Nephroplus. Welcome, Mr. Vikram, to the webinar here.
Thank you, Mr.
Have you. We have with us Professor Prasad, who is the Director for Academic Wing. He is also there. Ladies and gentlemen, the webinar this evening is also being live streamed on Facebook on ICFAI online handle. We will have in the next 1 hour or a little more, a very interesting conversation we are all looking forward to. Over the last 1 week, we have been receiving several registrations, and registrations mean very interesting questions also from various participants. So what we are going to do now is we will introduce the guest first, and then we'll begin the talk. And soon after the talk, we will get into the Q&A session. So permit me to share the screen, please. We have Mr. Vikram today. He's going to talk about ethics and leadership perspectives from a healthcare entrepreneur. As I said, the agenda is 30 minutes of talk by Mr. Vikram and the next 30 minutes or 45 minutes of Q&A, moderated by my colleague, Professor Prasad and I. Ladies and gentlemen, we take honor and pride to present Mr. Vikram Vuppala. Mr. Vikram is the founder and CEO of India's largest dialysis network. Now it is Asia's largest dialysis network, that is Nephroplus. After spending about 10 years in the US healthcare industry, his passion to redefine healthcare delivery in India has actually prompted him to found Nephroplus in the year 2010. Mr. Vikram has expanded Nephroplus to Asia's leading dialysis network of 250 centers in 150 cities across 4 countries. That's a very, very big achievement. Nephroplus has rapidly grown under his leadership to become the 7th largest dialysis network in the world in just a span of 10 years. He had raised more than 70 million USD in 4 rounds of private equity funding over the last 8 years from Bessemer Venture Partners BVP, IFC, and InvestCorp. You'll be very happy to know that prior to founding Nephroplus, Mr. Vikram was a strategy consultant at McKinsey in the US. Mr. Vikram, with over 2 decades of global healthcare experience, has helped various healthcare firms on strategic issues such as business development, growth strategy, portfolio rationalization, and M&A. Prior to McKinsey, he worked at Abbott Healthcare and ZS Associates. He has been a speaker at numerous entrepreneurial, healthcare, and investment conferences as expected. Mr. Vikram did his BTech from IIT Kharagpur, MS from the University of Illinois, Chicago, and MBA from the prestigious Booth School of Business, Chicago. So with this brief introduction, I would now request and also thank Mr. Vikram for joining us once again and request him to begin his talk. I will now stop sharing my screen. Ladies and gentlemen, I have one request to you. Kindly mute all your mics and let us pay attention to some of the lessons, some of the ethics and leadership issues as Mr. Vikram is going to talk about. After that, we have a large session of Q&A ensuing soon after his talk. Over to you, Mr. Vikram, and thank you.
Thank you, Mr. Sudhakar, for inviting me for this talk. I've talked about entrepreneurship quite a lot in various conferences. This is the first time I was asked to speak on ethics and leadership, so I had to spend a little bit of time to jot down a few talking points for this conversation, because this is not the usual topic in various startup summits, entrepreneurship, healthcare summits. I think it's a very important topic. I'm glad that we are having this conversation. And I'll try to wrap up very quickly from my side, and I would love to spend more time on Q&A so that people actually get benefit out of it. I can speak about entrepreneurship or this leadership as well for a long time, but to better serve the audience, I think it's important to give appropriate time for the Q&A session. Now, my talk will be in 3 broad sections. The first section, a smaller one, would be just to introduce Nephroplus to the audience in case people have not heard of Nephroplus at all. The second section would be on ethics and leadership in general. And the third section, little bit brief than the second section, would be on ethics in healthcare in specific perspectives on ethics in healthcare. So firstly, on the first section, introduction to Nephroplus, I mean, we started about 11 years ago in the city of Hyderabad. After spending 10 years in the US healthcare industry, I was very keen to move back to India and sort of participate in the healthcare delivery revolution. And my thesis was that there's a lot of diabetes and hypertension disease burden in India, and India would need a lot of startups and help and support in this disease burden ecosystem. So that's how I had like 4 business ideas, and I started traveling around the country. And fortunately, out of the 4 ideas, when I met my co-founder, Kamal Shah, who has been with us for the last 11 years, I realized that Nephroplus is the right startup to work on. Kamal happens to be 45 years old now, and when we started, he was 34, and at that time he was on dialysis for 13 years. So now he's on dialysis for 24 years. And when I met Kamal in Hyderabad, I realized that if we have a co-founder who is on dialysis himself, then we would understand the customers better than any other network in the world. So that's probably the USP that we latched onto, and we with Kamal's help, we redefined the entire patient experience in the Indian dialysis system, and we completely revamped the protocols, the operational systems, the look and feel of the centers, everything. And that's how Nephroplus got started. We raised a couple of rounds of angel funding, and then we figured out how to run multiple centers in the same city, multiple centers in multiple cities. And before we realized, we had a Series A investment from Bessemer Venture Partners. That was 2011 November, almost 10 years ago. And they still continue to be a shareholder in our company, even though we had given them an exit option 2 years ago. So we just focused on the patient care. In Nephroplus, we call our patients as guests. We don't like the word patient, because if a person is admitted in an ICU and fighting for their life, it's okay to call them patient. But dialysis is a lifestyle disease, and the kidney failure is a lifestyle disease, and people come driving their own cars, bikes, and they come get dialysis and go back to their home. So we call our customers as guests, and we have just been focused on guest care. And one of the fundamental core values of Nephroplus has been guest care comes first. And with that razor sharp focus, we just kept on doing good work. And as we expanded, and then more and more investors got excited about the story, and we raised Series B from IFC, which is a World Bank venture arm. In 2014, we raised a Series C. In 2016, we raised a Series D in 2019. So we just kept on expanding, but our razor sharp focus has always been on the guest care. Nephroplus, over the last 11 years, we have grown to become the largest dialysis network in India, now in Asia. And our network is spread across 4 countries, 165 plus cities, across 265 centers as of today. And the whole problem which gets magnified is, if it's a large 1,000-bed hospital in a city, or if it's 3-4 hospitals in 3-4 cities, it's a different problem. But if you have 265 centers spread over 165 cities in 4 countries, managing them in such a distributed network becomes a Herculean task. It's extremely challenging. But we have been passionate about increasing access in tier 3, tier 4 cities of India. And hence, while we could have built the same top line and bottom line by focusing on the top 10 cities in India, we were, as founders, we were always more passionate about opening a center in a smaller city. Like, for example, the third center of ours was in Mehboob, which was the first dialysis center in Mehboob. We opened the first center in Khammam. We opened the first one in Nalgonda. So almost in that 165 cities, there are 120 plus cities where we were the first ones to open a dialysis center. So that gives a unique sort of satisfaction that we have been able to redefine dialysis care in India. And before Nephroplus, people used to travel to the bigger city in India, like a tier 3 city to a metro city in India to avail dialysis, right? And when people relocate, their entire family, when they relocate, there's a lot of disruption in terms of kids' education, in terms of social networks of the patient family members, and so on and so forth. So I think that has been a unique redefining opportunity for us. Now people don't relocate to bigger cities anymore because of Nephroplus. So beyond all the top line, bottom line, whatever the numbers, I think redefining dialysis care in India gives us the utmost satisfaction. And I think it's essentially, from a leadership perspective, me and the co-founder Kamal, we have always been focused on the guest care, and that has served us well, and that will serve us well for the next 20, 30, 40 years as we continue to grow the network. So that's a very brief overview of Nephroplus. I don't want to spend too much time on that. Coming to the second section, which is on ethics and leadership in general, and the third section will be specifically on healthcare. In the second section, I had few talking points and would love to engage more in the Q&A session. The first one was, I think the whole world is moving towards a thesis where commercials at any cost. So be it profits, be it top line, be it valuation, whichever way you look at it, it has become completely commercialized to an extent that businesses or organizations are focusing on commercials as the number one optimization. So commercials at any cost is causing too much disruption in the ethics and leadership world. Because when commercials are prioritized to such a large extent, something's got to give. You can't have great commercials, great ethics, great leadership, great value system, everything being together is very difficult. For example, we all know how Facebook has faced a lot of flack over the last several years in terms of privacy and so on. How Google has faced a lot of flack. How many of the large startups, even in India, let's take Byju's example as an edtech business, the sales commercial engine, the sales engine is widely critiqued upon. So when commercials at any cost become the main theme, something's got to give. And it's usually the ethics, it's usually the value system in the organizations, right? So this whole unhinged capitalism where commercials are the number one optimizing parameter, be it top line, bottom line, number of users, number of monthly active users, be it valuation, whichever way you look at it, that has put too much pressure on the ethics platform in the business world. And I think it's real. If you look around, you will acknowledge it. We should not be in the denial mode about it. It is real that businesses all over the world, and I'm by no means speaking about just India. I travel around the world and it's consistent across the world. Unhinged capitalism is here, and unhinged capitalism is putting enormous pressure on ethics in the business world. The second point I had was, ultimately the ethics of an organization is dependent not on the management team of an organization, it's dependent on the owners of the organization. What do I mean by that? I mean the shareholders of an organization will determine the ethics and the values of the organization. sometimes people may think that, hey, no, it's the CEO who determines the values of an organization, the ethics of an organization. If the CEO is a small owner in a company and the majority stake is held by other shareholders, other owners, in the board meetings, what happens is the shareholders set the tone, or the owners, majority of the owners set the tone in general. There will always be very, very few exceptions, 0.1% and so on. But let's take it as a fair point that it's the owners who set the tone on the ethics. Now, how do they set the tone? If a management team or the leadership is doing the right things, but the commercials suffer, the owners, in general, 99% of the owners don't like it. 99%, 99.9% of the owners would want great commercials, and they don't want to hear the underlying risk factors, underlying ethical factors, right? If your performance is great, no questions get asked. If the performance is not great, many questions get asked. So the owners are the one, the shareholders, majority of the shareholders are the one who are determining the North Star of an organization. Now, in startups, there are companies where the founders have disproportionate voice, disproportionate voting rights, whichever way you want to call it, or the founders have disproportionate credibility in which they will dominate. If they are very particular about ethics, they will ensure that ethics prevail over commercial maximization formulas. So I think people sometimes, they don't understand this owners versus the management team issues in terms of driving the ethics and values. That was the second talking point. And owners will always incentivize the management team towards commercial maximization. So I'm sure when you look at any of the reports that you see in terms of management compensation, I'm sure you realize that it's usually percentage of profits or percentage of top line growth based on various metrics. Ethics and value system does not factor in any of the management team incentives. So structurally, it's a lopsided issue. Structurally, it's a messed up issue, right? So unless the founders or the leaders of an organization are very headstrong and very particular, it's all downhill. The commercial optimization takes over. That's the sad reality. We should again not be in denial. That is a brutal reality. I think the third talking point is around the nuance of ethics versus ethical, unethical versus legal, illegal. Now, legal, illegal, no one wants to do illegal stuff, right? People can get caught and people can get jailed. But ethics is related to legal and illegal, because if you want to do something wrong, you will figure out, if you are unethical, you will figure out a way to legalize the illegal act. What do I mean by that? I mean, sometimes what happens is some companies don't want to pay bribes to the government officials because it's illegal, right? But many of the companies all over the world have figured out, distributors have figured out other third-party agencies through which a consulting arrangement gets done and the payments get done to the end required party, right? So if you are unethical, it's very easy to legalize illegal activities. That's a nuance. No one wants to do illegal stuff, but if you are unethical, you will figure out a way to do illegal stuff in a legal manner. And there are hordes of lawyers who will be happy to fight your case to keep you out of the ambit of justice system, right? So I think the key is to figure out how to introspect and figure out your own ethics North Star and be focused on it and not get swayed because of the board pressure or the shareholders pressure or various other short-term pressures. I think it's a gray area. Ethics will determine what you do in a gray area context. For example, if it's a black and white situation or a 1 and 0 situation, It's a no-brainer. Everyone will take the right decision. But ethics will be tested only when it's a gray area where you can go this way or that way. Both are permissible options. But if you are ethical, you will take the right decision. If you are unethical, you will take the slightly less right decision. So your North Star will help you take the right decision rather than the suboptimal right decision. And I think one of the strong points I had on ethics in an organization is the employees in an organization, they don't determine the ethics North Star by looking at the value statement or the website or the town halls or the speeches, interviews by the leadership. What I call them, this important moments, these are called moments of truth. Moments of truth is where the leaders take decisions in an organization and the entire hierarchy is watching what is the decision being taken. And the moment of truth is when the leader, despite what some companies may have very, very flowery values statement, flowery ethics driven statements and aspiration. But when it comes to the moment of truth, the decision taking time, if you take an unethical decision, all the literature, all the website, all the interviews, all that goes into the trash can. What matters is the moment of truth. Your people will look at you based on what decisions you are making. It's not based on what you're saying or what you are having on your website or in your value statement in the company. So moments of truth will determine your company's ethics North Star. What decisions are you taking versus what you're saying? What you're saying does not matter in determining the ethics North Star. And the beauty about moment of truth is that there is a huge, massive amplifier. What do I mean by that? If an ethical decision is made, there is a massive positive feedback loop in play where all the hierarchical employees are looking at ethical decision and they also will start taking ethical decisions and it gets rippled across the system. In the same way, if a leader is taking an unethical decision, the same decision will be amplified again in the negative side. If they are taking an unethical decision worth 100 units, the next person will stretch it to 200 units, the next person will stretch it to 400 units, and so on. So both the positive amplifier and negative amplifier is a reality. So the moments of truth are extremely important. What you do or what you decide matters 1000x more than what you say in terms of ethics and leadership. I think the other fourth talking point was ethics. As I said, trickle down from the leaders in an organization, and tone is set by the leader. For example, if the leader is highly ethical, it's very likely that the organization will be filled with a lot of ethical leaders. But if the leader is unethical, it's very difficult for them to attract ethical people in the ecosystem. So an organization North Star is determined to a disproportionate amount by the leadership's ethics North Star. So it's important for the leaders to take the right decisions, which may cause pain in the short term, but it will yield rich dividends in the long term. Now, that's a tough one, right? Everyone, the whole world is going towards instant gratification. I want everything right now. I want to order on Swiggy. I want food in 30 minutes. I want to order Uber. I want the car in 5 minutes. Instant gratification is the key. And hence, for you to take a tough decision, right decision, which will cause you pain in the short term, but it will cause greater good in the long run, it's not that straightforward. It might sound theoretically very easy, but practically it's very difficult. So it's something for all the leaders to think about. One example I can share is 4 years ago, we had a very top performing sales leader in Nephroplus. And this guy was a rock star in terms of closing business development deals for us. He was bringing in a lot of business, but then there was a sexual harassment complaint on the sales leader, and he acknowledged on the sexual harassment that he proposed for a favor. So we immediately had to fire him, and there were some people in the board of directors who were saying, okay, let's do a 6-month transition time. Why should we fire it immediately? Let's give a transition time of an year for this person so that the business is not rocked in terms of sales growth. So we took a hard decision saying nothing doing. Such a person cannot work for a single day in the organization. Now that sent a huge positive ripple effect in the organization, where the women in the organization felt very safe and very proud to work in an organization where the best performing sales leader had to be fired from the company, regardless of the short-term commercial hit. Short-term, there's always pain, but in the long run, it yields very, very rich dividends, right? So leaders need to take the pain in the short term for the longer term benefits. The final talking point here on ethics and leadership is that skills can be taught, ethics cannot be. So technical skills like analytical skills, Excel, PowerPoint, Word, or whatever programming languages, all these can be taught. Ethics cannot be taught. I've seen this over the last 20-21 years. I was initially very naive and hopefully romantic, but the more I've seen, the more I realize that ethics cannot be taught. It's a binary outcome. It's either there or not there. So as a leader, what do you do? As a leader, you've got to clean up your organization. You constantly need to identify the bad apples, fire them. You constantly need to add good apples and nurture them. So don't think that, okay, this person was unethical at this time, but I'll counsel him, I'll take him out for a lunch or a coffee conversation, mentor him, counsel him. Doesn't work, just does not work. Skills can be taught, ethics cannot be. That's the final talking point of ethics, the second section. So I'll move to the third section, very brief. It's already 7 o'clock. I'll be very brief on ethics in healthcare topic. Healthcare is a very, very challenging industry, right? And one of the main reasons for that is essentially, literally lives are at stake. What do I mean by that? If you are in a fast food business, restaurant business, quick service restaurant, QSR business, if you cut corners, you do unethical stuff, some customer may get food poisoning as an outcome. In healthcare, people can die. People can get cross-infected with Hep C, Hep B, HIV. In the dialysis world, they can get cross-infected, right? They can die. So in healthcare, you got to be very, very careful in terms of how you deal with ethics. For example, Nephroplus, we have taken a call that we will not franchise our dialysis centers at all for the last 11 years. And right from day one, right from year 2, we have been getting so many requests, but I don't believe franchising is possible in healthcare because franchisees will cut corners to make some more money. But unlike a fast food restaurant, here people can be infected, lives can be lost. So the stakes are very high, the risk is very high. So franchising in healthcare delivery, I don't believe in at all, especially in the delivery space, right? Margin for error is literally zero in the healthcare system. Now, the second point here was, I think in healthcare, if you want to have ethics in your healthcare business, the purpose has to be extremely clear and the purpose has to be reinforced every single week or every single month throughout the organization. Because if you drive towards optimizing on commercials, regardless of the ethics, then it's a slippery slope and it's always downward slippery slope. So you will have to be patient in healthcare. You cannot, in healthcare delivery, you cannot create a business and say, oh, I want to be a unicorn in 3 years, 5 years. ethically it's just not possible. In delivery, I'm speaking. So you just got to have a strong purpose, and people who have looked at creating healthcare businesses purely for commercial gain, they get burnt out, because the hassle cost is so high in healthcare business that unless you are intrinsically passionate, you get burnt out. A lot of startups got started looking at Nephroplus success, and they all realized in few years that it's such a tough business, such a painful business for such low margins, right? And they were not intrinsically passionate about dialysis. So if you are looking at commercial, superlative commercial outcomes, healthcare delivery is not the place to be. And if you want it to be ethically run, healthcare delivery is not the place to be. There needs to be an overarching purpose, overarching reason for you to start a healthcare business. And I found the purpose through Kamal, my co-founder's help, and that's how we got started on Nephroplus. So I think purpose, there is a nuance point here, which is if you talk to any pharma company in India, if the flu season, I have interacted with few pharma companies where the sales leaders were sad that the flu season was very mild, right? So when the flu season is mild, we all should be happy. People are getting less sicker. But in various sections of the industry, be it hospitals, pharma companies, and so on, people want the feeder to be very strong, right? That's a ridiculous thing in healthcare. What is the primary purpose for you? Your primary purpose is, if somebody is in a lot of pain, somebody needs a lot of help, then we will help them alleviate the pain. You would never want people to be in pain, right? And you would never want, if people are not pained, you would never want, oh, how come the business is slowing down, people are not in pain. But that is the brutal reality across the industry, where if people are not in pain, industry is disappointed, industry is in depression. So that's why fortunately the dialysis world in our world is such that you can't do dialysis for a person who does not need dialysis. So that gives a lot of peace of mind for us, that we are not pushing excess care to people who don't need that care. Dialysis cannot be done for people who don't need it. So, but various healthcare companies in the ecosystem, they want to push the commercials to the next level. If it's in the gray area, if it's a diagnostic test, you would always want few additional tests rather than few lesser number of tests, right? And it's not a 0 or 1, it's the gray area, and ethics matter when it's the gray area. Ethics do not matter when it's a 0 or 1 question, right? So I think healthcare companies, especially leadership in healthcare, needs to be very, very careful and be focused on the purpose, the intrinsic purpose. And if your organization is only focused on commercial optimization, you better get out of that organization and join a better organization if you want to be in the ethical side of the business, right? I think the final point in healthcare from an ethics perspective and leadership perspective is, in healthcare businesses, leaders have to be especially much stronger than in non-healthcare businesses, because as I said, the margin for error is zero. People's lives are at stake, literally. So unless you stand for your values and ethics, you should not become a leader in the healthcare businesses. So I request all the people who are interested in, who are in healthcare or who are going to be in healthcare, the leaders, to be very, very strong and push back on any of the commercial pressures that you may face. So I'll pause there. I introduced Nephroplus. I talked about ethics and leadership in general, and I touched upon ethics and leadership in healthcare in particular. So I'll pause there, Sudhakar. Happy to answer any of the questions, please.
Great, Vikram. I think that is a fantastic outline about what this session would cover. And I'm extremely happy that you have actually covered a lot of ground in such a short span of time. This is indeed a very difficult topic. And every time we broach this topic, There are layers and layers, and then there's a lot to learn. As you said, this basically is a gray area, and when it is a gray area, I think several perspectives from especially leaders like you, and more so coming from healthcare sector, it makes a good listening, one, and number two, it is extremely important for us to translate this into action. I think in our own businesses, in our own practices, in our own thinking processes, I think everything has to be translated, and there are very good lessons for us. Just to give a brief overview of what you have covered, very, very pertinently, is that the owners of the organization decide the ethical compass and not the management team as it is. I mean, the management team is on the front side, they are facing the customers and the world, but the key lies actually with the owners. They are the shareholders which decide. Shareholders in the board meeting, the kind of discourse that you have in the closed doors meetings is actually a determinant of your ethical compass, and therefore the challenge is much, much more. Unless you are intrinsically passionate about ethics, and as a leader, if you are strong, you cannot actually move forward. So no matter what you say, you can have a great advertising agency and drop value statements and display it around your organization in your front room, but the decisions taken by you, the actions taken by you will actually determine how this organization is progressing on the axis of ethics. So great, I think those are fantastic points, but all through you have maintained a very, very nice smile on your face while talking about these candid points as well. I mean, that's something I would like to compliment you, Vikram, for telling the most difficult thing with a smile. I think you're best suited to be in the healthcare industry. I think that I'm really liking it, because some of the times when we speak the harshest things, it shows on our face. But for you, I think you have crafted it very well, or you would have right from the beginning been the very person like that. So I would compliment. The candor is what I'm actually appreciating. Several issues of practices, several issues of healthcare industry pointers that you have shared, they're all going to be discussed now. Thank you very much for this. I want to tell you that Mr. Somashekar, the former bureau chief of the Hindu Business Line, has joined us.
Yes.
We welcome him. Our Honorable Vice Chancellor of ICFAI Foundation for Higher Education, Professor Mahendra Reddy, has joined. Several other colleagues have joined. Delegates from HMA have joined. And more importantly, as you have reached 265 centers across the country and around the world, mostly in India, tier 2, tier 3, and tier 4 cities, some of our regular participants have been from these cities and towns, including today. So we welcome all of them, and we thank that there has been a great connect. Nephroplus is very popular. People connect to this brand and the kind of healthcare delivery that you have been providing all the while in the last one scintillating decade of your service. So thank you very much on that note, Vikram. I will now bring in Professor R. Prasad. Professor R. Prasad is my esteemed colleague. He is the director for academic wing. He has architected the latest program that we have launched. It's called Online MBA program. We launched it a few months back. It's doing extremely well. The platform has been designed by Professor Prasad. So Professor Prasad is an alumnus of IIT Bombay and IIM Calcutta, and he was an entrepreneur himself. He has experience in corporate world and academics. So 3 decades of rich exposure and experience makes what Professor Prasad is all about. We request him to start the session today. He will moderate, and we have actually a few clusters of questions, as I mentioned earlier. The first cluster will be started by Professor Prasad, and then we'll alternate. So over to you, Professor Prasad, and thank you.
It's been a very wonderful introduction, Mr. Vikram. And I think your background also shows up in the way you presented the whole scenario. And we want to draw upon that, as we have kept it as ethics and leadership. So the first set of questions will be about leadership, and then we'll move on to ethics.
Sure.
The other thing that we are very happy about is that we have had courses which are targeted at healthcare. A lot of people mistake healthcare to be only hospital, and not look at the entire value chain, which is there. And in fact, we have a course in patient experience management. And therefore, we are all the more happy to hear from you on many of the salient aspects which are related to and connect to both. The first cluster is more about your personal experience and your journey. And this is where we'd like to bring in the leadership angle. Um it is about what motivated you to become an entrepreneur. How did you choose this field? You did say that there were 4 business ideas and then you zeroed in on one of them. And what are the qualities uh, which have helped you in your journey till now, including the ethical?
Very good question. So right from my undergrad days, I've always been uh, more passionate about taking leadership roles. I was the general secretary for the hostel where I lived. I was the vice president for the chemical engineering department where I studied in Kharagpur. So that whole leadership sort of inclination has been there right from the beginning. And right after undergrad, I wanted to do a startup, but this was 99. I had no clue what to do about a startup. And then I heard that one of my family members said, hey, if you do a MBA from a very reputed school, hopefully from US, then there could be more startup ideation that happened and more skill set that you can gain. So I realized, let me work in US for a couple of years and then join a B school. And in Chicago booth, I primarily focused on entrepreneurship curriculum. Entrepreneurship and finance were my 2 majors. There's a very good new venture challenge, sort of a course in Chicago booth where you practically prepare a startup pitch and you pitch to the live investors, real investors, and you win tens of thousands of real seed money. So I participated in that. We won the second prize there. So right along, it has been how to be an entrepreneur. But post B school, I had a big tuition loan. So I had to spend a couple of years at McKinsey to pay back the tuition loan. And then I moved back to India. And when I moved back to India, in the diabetes and hypertension ecosystem that I mentioned, there were 4 ideas. One was dialysis network, which is fairly well established in the developed world. The second was community diabetes clinics. The third was selling glucose monitors, BP monitors online. The fourth was distribution related to diabetes and hypertension products, offline distribution. But the more I traveled around the country, I realized that at that time, in 2009, India was not yet ready for some of the other ventures where unit model was not coming out very strong. But after I met my co-founder Kamal, I realized that this could be a very powerful combination where I bring in the business skill set and Kamal brings in the patient perspective. The combination will be really good. So that's when we zoned in on Nephroplus dialysis network, and it has served us well. So that's the whole angle of entrepreneurship. It's been there for a long time. It only happened after I moved back to India.
Thank you very much. I think this combination of the business and the guest side of it has worked out in this particular case, and I think
Yes.
that's one takeaway. We now come to the second part of the question. You've had in your previous corporate experience, you've also had the healthcare experience. So if you look at India, what kind of market size exists for the segment that you currently operate in? And if you can throw some light on some of the other segments in healthcare for potential entrepreneurs in the audience and for business managers, it would be
Absolutely.
yeah.
Sure. So dialysis market in India is $500 million today, but it's growing at a very rapid pace of 25 to 30% year on year. But what we are looking at is a global dialysis market, which is $110 billion market. Of course, 85% of it is in the developed world, like the US, UK, Western Europe, Australia, New Zealand, and so on. But with our foray in Philippines and Uzbekistan, the aspiration is over the next 10, 20 years, we will disrupt the developed world dialysis market as well. So the market for us in India is $500 million, globally $110 billion. and we still hold very small market share in India, and of course globally it's a minuscule market share. Now the other segments, I think if potential startup ideas are being looked at, there's a lot of action in the health tech space where the whole digital experience for the prospective wellness or health seekers, if startups can help digitalize the whole experience and make it much more convenient, there's a lot of action happening there. It could be a massive $10-20 billion market opportunity. Next 10-20 years, we'll see a lot of value coming from the digital health tech space. And the traditional delivery, be it hospitals, is a very big business, but it's a very tough business unless you achieve a certain scale. So if you're not highly capital empowered, then hospitals is a very tough industry to be. The other segment is the diagnostics, which is a massive industry, at least $10 billion in India already, and growing very rapidly because people are becoming more health conscious, have more health checkups are happening. There also, you can create a very solid business, and there is a lot of requirement even beyond metros in tier 3, tier 4 cities. Very good high quality diagnostic opportunities are also there. There are some very large players in India already in this space, like Dr. Lal, Metropolis, Thyrocare, and so on. But there's always an opportunity. The market is so big that there's always an opportunity. So these are some of the segments. Eye care is growing steadily. Oncology is another area where there is a lot of action happening on the startup space, and that's more related to digital oncology. How do you serve the patients, cancer patients, in a online plus offline? Offline will be light touch, online will be heavy touch model. So there's a lot of action in oncology. IVF clinics, that's a massive industry, but it's very dodgy, very gray in terms of the market practices. That's another very large industry. So I think the healthcare industry is so large that you can pick up any particular segment and make a big dent, and you will create a large business. But you need to have an edge. What is your USP? Like Kamal being the co-founder of Nephroplus is the USP. What is your edge to make a disproportionate impact in that disease area or in that segment? That's something that you should really look at before starting up.
Thank you. I think there have been a lot of very, very practical segments that you've spoken about. And for all the potential entrepreneurs who are listening in, I think there's a potential market study and project possibility in what you're saying, including many of the MBA students who want to get into this later. I think the point you brought about of wellness and this care versus cure business, I think that also is something that gives a lot of opportunity to people. It's very encouraging to hear that it is so large that, and there are so many segments that a lot of people can help out in India's development in this particular space.
Yeah, absolutely.
The third question, I'm also connecting to one of the chat questions, is, in your moment of truth point that you brought out when you were discussing, you also answered one of the questions in this cluster, which is basically about when you grow fast, how do you do so with ethics? This question is related to, when you do so, how do you caution against failure? Again, it's a entrepreneurship management question. Ethics is also there, but it's also about how do you maintain the business so that the failure rate is, the risk is reduced.
Yeah, it's a very nuanced question overall, Professor Prasad. I think there was one instance in Nephroplus journey where about 5 years back, we were growing so fast. In a normal month, we open 4 to 5 dialysis centers in a normal month these days. It's since last several years. But 4.5 years back, we were opening 6 to 7 centers per month. The growth rate was too high. And then we realized that, hey, the quality of clinical outcomes, the service levels, the feedback suddenly was dropping. from the sort of the NPS scores or the satisfaction index for the partners and the guests, right? So then we realized that, hey, we are growing too fast. And in healthcare, if it's like a normal product delivery manufacturing plant, right? It's different. You can scale up, you can introduce new capacity and you can scale up. But in healthcare, because you're dealing with lives, you cannot just, there's no hockey stick in healthcare. So you got to be patient. So then we actually shut down our expansion for 6 months. We called it as Project Equip, where we didn't expand at all for 6 months. We created a transition team which had transition managers, admin managers, and clinical managers, whose only job is to ensure that new centers that we are opening are conforming to the Nephroplus standards, where these people will be traveling all over the country, going from one new center to the other new center to the third new center and so on. Spend 2 months, make sure the Nephroplus standards are in place, right? And that's when we realized we won't launch more than 5 centers in a month until we feel comfortable. So this is where the leaders need to take a hard call. Of course, your top line for that 6 months, we didn't grow, right? That's a big question mark. Hey, how come Nephroplus paused growth rate? But in healthcare, the guest care comes first. That's the core value. If the guests are not benefiting, then what's the point of expansion? So we had to invest in this transition team. We had to stop complete new centers growth for 6 months, but that has served well. And we realized, hey, we can only open max 5 centers in a month where we don't compromise quality. Even today or every other quarter, there'll be investors who come to us and say, hey, it's a great story. If capital is an issue, we'll put in 25 million, 50 million USD. Can you open 20 centers a month? Why pause at 5 centers, right? So I keep telling them it's not about capital at all. It's about how well you can deliver the quality outcomes and service level. It's not, healthcare delivery is not a capital issue. It's a protocol issue. It's a clinical outcomes issue. It's a life at stake issue. So just because you have capital, a lot of companies, startups go through this phase. Even in healthcare, there are a bunch of startups who are into primary healthcare, and then they raised a ton of money and they expanded way too fast. And they shut down equally fast, because when you expand way too fast without managing the quality, ultimately your brand gets messed up. Your reputation goes down. The consistent outcomes that you want, if you don't have a good product, it's not sustainable in the long term. So many startups tend to fail when they expand, especially in healthcare, when they expand way too fast and forget the primary purpose that they have come to the table with.
Fantastic. I think you've given one major point. And this is about, what we call the growth has to be matched with the fulfillment. And
Yes.
the delivery is what gives the fulfillment. And this is something that we have also experienced when we are doing the online MBA program.
Mm-hmm.
It's not just about executives coming in and joining the program. At the end of the day, they should be able to also add value to themselves. And partly that is found in how they're able to respond to the program and fulfill the assessment requirement. I think that's a very, very important point. And once you've got those systems in place, it's far more easier to scale up. Thank you. We come to the end of this cluster. I hand it over to Professor Sudhakar.
Thank you, Professor. I think it's very interesting. Vikram, we are entering into additional layers of discussion as we are moving forward.
Sure.
I come to the next cluster of questions, and it is the mantra in the corporate world currently, including healthcare and everywhere. It looks like you preach ethics but practice profit. I mean, that's what we generally get to see, myself and most of the participants.
Mm-hmm.
Ethics is one of the most overrated, or it is the most overrated variable in leadership. The rhetoric more often than not is a clever smokescreen kind of thing for whatever the unethical practices that they end up doing. So your comment on this?
Yeah, I mean, it's very difficult, right? When leaders are not vested in a long-term success of the company, it's very easy to to go in the wrong direction, in the gray area. In the 0 or 1, it's very clear, very easy. But in the gray area, it's difficult. And if the organization, as I said, the owners, the key leadership, either the owners have to be really aspiring to create a strong ethical organization, or the leadership has to be so strong to manage the owners to build the ethics North Star, right? So one of these two things needs to be there. Otherwise, if the leadership is not ethical, it's very difficult for employees in an organization to fight upwards. Fighting upwards is not easy. You can push ethics downwards. You can't push ethics upwards. It's very difficult.
Great. Within Hyderabad, I had experienced, or at least I looked at certain outward signals. Some of the prominent hospitals, some of the big ones, actually, I don't want to take the names.
Yeah.
They displayed the Diwali kind of lighting on their outside building, on the facade. A shopping mall generally would do to attract crowd. You are encouraged to enter into and shop more. But then a hospital, you don't have happy hours in hospital, right? It's not a bar. I've seen that prominently happening in Hyderabad also. I don't know about other cities, and you have greater experience across many other cities in India and abroad. That is something, yes, as you rightly said, relates to the ownership and what kind of drive or what kind of signals the owners are giving to the management team, so that they are cutting short their so-called invested in long-term benefits kind of formula with which they entered the actual business in the first place. So the second question, therefore, is, against all these challenges, how do you ensure? One is the top-down approach. What are the other approaches you would suggest to ensure leadership at various other levels, especially in a healthcare organization like yours?
Yeah, I think it's important in healthcare for the leadership to have patience and the owners to have patience. Healthcare delivery, especially, as I said, it's not a hockey stick business. You need to be vested in the long term. And many of these practices that are coming into the delivery are attributable to private equity coming in a big way into the healthcare delivery system, right? Now, what is private equity? Private equity is there is a general partner who manages the funds of a private equity firm, and there is a limited partner who are the owners or the people who are putting the funds into the private equity firm. They are called LPs. The people who are managing the fund are called GPs. Now, GPs, all they care about is the IRR, the internal rate of return. How much money have we put in? How quickly can I make a decent return? And usually the investment horizon is they need an exit in 4-5 years. When a private equity firm enters any business, in 4-5 years, they look for an exit. Now, as I said, in healthcare delivery, there is no hockey stick. You need to be patient. So that's where the tricky balancing act comes in, where you grow fast enough, but you don't compromise quality and outcomes and the service levels at any cost. Now, for that, patience is required, strong leadership is required, ability to give an exit to one private equity by getting investment from another private equity firm, right? So if there is too much pressure that, okay, in next 2 years, I need to sell my stake and move on, that puts inordinate pressure on the management team. Then the Diwali lights come out. That's what happens.
I think several takeaways there in terms of the existing practices and the structure, how it is operating, which ends up actually putting so much pressure on the management team. And one of the ways in which it shows up is the Diwali lights. Very unfortunate. Mm-hmm. The next question is about the Hippocratic oath that we all hear about or read about includes ethical dimension, if I'm right.
Yes.
What are the practical challenges to that? We are in healthcare sector. We all swear by the Hippocratic oath. And so where are the challenges there? Does it help, or this is one more facade?
Yeah, I think the challenge is somewhere else. The challenge lies in the medical education fees structure. So if I'm a doctor and I'm putting in 2 crores for a radiology seat, and I'm investing 2 crores in a radiology seat, and I'm working I'm tirelessly studying and working for 10 years to get a degree, then of course I need to see the returns, right? If the education is free, it's a different equation altogether. But the medical colleges fee structure, I believe, is fundamentally a big reason for corruption in healthcare from a physician's perspective. Again, it's being a doctor is not at all easy. Being a doctor is extremely challenging, and I empathize with the doctors who don't have weekends like many of us do, who don't get disturbed during a Sunday or a Saturday. Doctors are on call 24/7. There's so much studying, so much investment that gets made. The sad reality is, doctor after 13, 14 years, they start making certain money, whereas an IT employee right after undergrad is getting very fat pay packages, right? So it's a very disempowering sort of an ecosystem. Of course, it's a whole spectrum. There are few physicians who are extremely commercial. There are many physicians who are extremely solid on ethics. But the medical education funding is just the way elections funding is the root cause of corruption, the medical education funding is the root cause of corruption in the ecosystem.
Wow, I think you nailed it. The medical education funding piece that actually is causing the trouble as far as the ethics is concerned within healthcare sector. So thank you very much for that view. There is another question. See, you already stated that there is no franchising in healthcare delivery that you believe in. We also believe in education that there cannot be franchising. At least the delivery has to be done by our own faculty members, and Professor Prasad will touch upon that a little later. That's an amazing piece, the value for the organization. So Mr. Vikram, how do you balance when you talk about pricing for healthcare delivery, the healthcare product, for example, how can you relate it to something like ethics? So you don't price is too high, you get it right, appropriate there, always be governed or always be guided by your ethical compass. How do you balance these two?
Yeah, it's a tough balancing act. I can give you a very specific example related to dialysis center in Nalgonda. So when we launched our first center in Nalgonda, there was no other dialysis center in Nalgonda. Now, if we were ruthless on the commercial side, we would say each dialysis in Hyderabad, if it's costing 2,000, I'll price it 3,000 in Nalgonda, because if a patient has to come to Hyderabad for dialysis, there is a transportation cost, there is a time that's being spent by them and the family members. Now, the pricing is related to economic value add. Economic value add, you will consider the travel cost, you will consider the time cost, you will consider the loss of earning wages for the family member. All that put together, we could have easily priced it at 3,000, and still the patient would grudgingly come to our center in Nalgonda. But we have started the center at 1,200 pricing. Now it's probably at 1,300-1,400 pricing. That's where the ethics come into the picture, right? There is a famous pharmaceutical company case, which is there's a guy called Martin Shkreli, who basically bought some pharmaceutical products in the US, which costs about $10 a pill, and increased the pricing to $400 a pill. Now, there is nothing rocket science in that pill, but he had the ability to price it to $400 per pill. So he's like, hey, I'm not doing anything illegal. It is not illegal. It is unethical to price a $10 pill at $400, right? And he's right now behind bars. He's in jail in the US. So people are always pushing the envelope in terms of unhinged capitalism. People are always saying, what can I get away with? What can I get away with? If there is a lack of fundamental ethics North Star. That's why the balancing act is the leadership needs to be very, very strong. Leadership needs to be very, very patient. Is the leadership in it for the quick buck or the long-term impact story? All these things will determine the nuance.
Great. That's a very touching example that you're giving. I am from the town of Nalgonda and I know about Nephrocare, Nephroplus, the establishment. My brother is undergoing, my elder brother is undergoing the treatment, and he's right now, he's one of the participants. He is keenly listening to you. And yes, he told me that it is around 1,200 rupees or 13 or 1,400 roughly around that. I think that's an amazingly balanced pricing that you've brought to that particular level of a city or a town where you are operating. So much of opportunity cost for the people who are attendants, who are actually doing dialysis for themselves on their own. They will have to go through so much of economic value add. So that's great thinking on your behalf. I want to compliment you and the entire team out there for displaying your ethical leadership out there. So one last question before I wrap up this particular module is that is ethical leadership a favor or a responsibility? One of the participants wants your views on that.
Absolute responsibility, no doubt.
Yes, fantastic. It ties up very well, quite consistent with the talk that we have been having so far. I would request Professor Prasad to continue the next session in the sense that next cluster of questions that we have for Mr. Vikram. Professor Prasad, please come in.
I think we have already understood the challenges which are there for the management team, and also the forces which come in from the ownership and the those who have invested into the business. Somewhere I have read, now I'm looking at it from a guest point of view. Somewhere I have read that about 2/3 of people who pass away because of kidney disease don't even know that they have it. It's one of the articles which has come out. Now, how do you, I mean, both as a venture or otherwise, how do you have something which communicates, makes guests know more about, such sort of information, try alternatives? What are the business ideas there? What kind of, how can we help these guests?
Yeah, it's a very tough one because diagnosis in the tier 1 cities is fairly decent, but if you go down the tier city system, especially in tier 3, 4, and 5, if a 50-year-old person gets edema, which is swelling of legs because of lack of kidney function, people will say, hey, this guy has lived for 50 years. It's time to say goodbye, right? So the diagnosis, there is no intent to take them to a nearby solid health center and get the diagnosis done. Slowly, the governments, the state governments in India are waking up bit by bit. There's still 90% of the heavy lifting that still needs to be done. But it's slowly dawning in the Indian ecosystem where people are going to the PHCs, primary health center, and we are trying to educate the ASHA workers and PHCs that, hey, if you see edema, it could be kidney disease and so on. But we have historically not invested heavily in mass marketing, or we don't do any marketing whatsoever about Nephroplus. So we haven't done huge investments in education around this, because connecting to a tier 5 city family, tier 5 town family is not that straightforward. Which channel do you use to get to them is not that straightforward. And how do you do it in an affordable way? The brutal reality is, whatever investments we do in marketing, ultimately in every business, the customer pays for the overheads. In dialysis business, let's say invest 25 crores in marketing across the country and educate on the diagnosis. That 25 crore cost will be apportioned over the existing guest base, and the price of dialysis goes up. It's a very, very tough balancing act for us to make sure the price is not going up. There is already huge consumables or the medical consumables inflation that we struggle to fight with, and we have no choice but to increase the price at select places. But we don't want to do unnecessary investments, or it's not unnecessary, but the investments that we cannot afford or our guests cannot afford. If we increase the price by 25%, many of our guests may drop off from dialysis and they may die. So it's a balancing act. It's tough.
Thank you. Thank you very much. I think it's heartening to know that your spend on marketing is what you have mentioned about it, and that you're very sensitive about this fact when it comes to pricing. And this actually leads to the next question, which one of the participants have asked. So if cost and profit are two motives which should be driving the state of healthcare ethics indirectly, how are you handling your processes and decisions on cost? You did give one example with respect to marketing cost. Can you illustrate with certain other costs on the delivery side?
Yeah, so we are very, very particular about cost efficiency, be it on the medical consumables, be it on the human resource costing. So we are constantly looking at, are we having more than what we need on a human resource perspective? Because every single inefficiency, our philosophical view is every single inefficiency in the system, the burden is borne by the guests. It's not borne by the shareholders. It's not borne by the management team. The burden is borne by the customers. Here, in our case, it's the guests. So inefficiency has to be cut down. Inefficiencies cannot be zero because the cost of monitoring becomes so high that it's not worthwhile. But how do you keep the inefficiency cost to a bare minimum? That's the balancing act that you have to do. And at Nephroplus, all the directors, each function head is empowered to take decisions to weed out inefficiencies. But it's a continuous process. There is no finish point where we say, okay, last 6 months ago, we came to a stage where all inefficiencies are weeded out. It never happens that way. It's a continuous process, and it'll be continuous going into the future as well.
Can you give us one illustration with respect to that? Say, for example, on the HR side or maybe any of the supply costing side?
Sure. So, for example, when we looked at human resource cost, there was a time before the COVID, just when the COVID wave 2 happened, we had a lot of bench strength to make sure if our technicians get COVID positive, then if they are in quarantine, then the guest care cannot be compromised. Dialysis has to go on. So we had about 125 bench strength on a contractual basis, right? It's not a permanent basis, but a contract basis. But then after wave 2 got done in June, the team, the function head realized in July, not in June when it got done, but late July, realized that, hey, bench strength contractors are still on the payroll, even though wave 2 has ended in June. So already July month has passed, August is about to begin. So in August, August first week, we took a conscious call that because the wave 2 has ended, we don't need the contract employees anymore, right? So 1 month notice was given, and by August and September beginning, majority of the contract staff got removed. So it's a constant balancing act where you have to keep on doing the right thing, but also keep the cost low for the existing guest space. It's not easy.
I think that also brings out the importance of the operational and the tactical management level to look at where this can be done and the kind of impact that it has on such a large issue as ethics, if not done.
Yeah, absolutely.
Thank you very much. I hand it over to Professor Sudhakar Rao for the next cluster.
Yeah, thank you very much. I think we are now getting into the final segment of our questions, and these are more direct questions and more, operational kind of questions drawn out of curiosity to understand more about where they are living and what they're looking at. So from that point of view, as you also said some time back, a lot of people in India do not go to hospitals for the fear of unbearable costs of treatment. Now, government intervention like providing insurance is one way for treatments. What is it existing currently for dialysis? Is there any insurance policy for dialysis which can be taken up when one's kidney is actually normal? Yes, sir.
Yeah, so unfortunately, when the kidneys, the problem happens because people do not invest in health insurance when they are healthy. So everyone thinks that, oh, we are healthy, what is the need for health insurance, right? But then the problem happens, and then on the retail insurance side, you can't get a health insurance policy if your kidneys have already failed, because it's termed as a pre-existing condition. Now, IRDA is working on some regulatory changes, but still we are far away from it. What helps actually is the Ayushman Bharat or the Aarogyasri scheme or the various state health insurance scheme, which cover dialysis as part of the health insurance scheme. But on the private side, unless you're part of a group insurance scheme, like if you're working for a Wipro or an Infosys, you have a group insurance where the employees have families covered in the group insurance scheme, where it still works out. But if you want retail insurance on an individual basis, there is no spread, because once your kidneys fail, you can't get insurance policy at that time, because there is guaranteed outward flow. There is no spread for the insurance provider. So the better thing to do is in India, the private insurance coverage is in single digits even today, which is a shame. People should get private insurance when they don't need it. That's when in future, when they need it, it will be applicable. But people, as I said, everyone wants instant gratification. If I'm spending the money today, I need to get the benefit today. People do not have patience to invest today and wait for the returns.
Right. I think a long way to go as far as this particular insurance awareness and insurance implementation pieces are concerned. Thank you for your response on that, Vikram. The second one is looks like naive, but extremely practical, according to me, is that how can one ensure that one doesn't get to the stage of dialysis? I know there is some awareness, and there is always a limitation to spreading awareness, education, and all those things. And there are a variety of channels who do that. I'm not necessarily saying that only Nephroplus has to do it, but then there are various partners in the entire healthcare spectrum that are doing. But pinpointedly, if you are being from the segment, if you can tell us what can be done to ensure that one doesn't get to the stage of dialysis working back.
Yeah, absolutely. So I think there are various steps people can take to keep their kidneys healthy. I think the biggest thing is leading a healthy lifestyle, which is easier said than done. In terms of making sure you have basic exercise in your regimen, you have reasonably healthy diet. Occasional binging is not an issue, but if you eat 5 days outside with restaurant food, then something's got to give, right? You can't abuse your body over a prolonged period of time. So, and then the stress factor is causing another issue leading to diabetes. And the reason for kidney disease is diabetes and hypertension. These are the two risk factors or disease factors. So if you lead a healthy life, you would stay out of the diabetes and hypertension ecosystem. And if things are bad, and if you are already a diabetic or a hypertensive, then how do you manage your disease in a decent manner with making sure you are taking the right medications, making sure you are following the appropriate protocols. And if you get into chronic kidney disease, if somebody is a diabetic or a hypertensive patient, then they should get an annual health checkup done. And if you diagnose kidney disease in the early stages, stage 1 and 2, you can pause the progression of the disease just with some oral medication. So that awareness around health checkups, annual health checkups for at-risk population is very important. Because in stage 1, and kidney disease is 5 stages. The last stage is kidney failure. If you can catch kidney disease in stage 1 and 2, you can pause the progression of the disease. If you catch in stage 3, you can delay the onset of dialysis by a few years. If you catch in stage 4, you can delay the onset by an year. Stage 5 is when you need dialysis. So I would rather recommend for people not to get into kidney disease funnel. But if you are getting into the kidney disease funnel, annual health checkups to make sure your disease is not progressing is the right way to look at it.
Very, very useful, sir. I think these are the tips that we all should actually write down and actually practice. Not to get into the funnel of dialysis or the kidney problem per se. Detect it early, do your regular tests, even annual tests, and try and prevent further damage as we move forward. I think that's fantastic and extremely directly useful. So one more question is.
So Mr. Sudhakar, there are a bunch of questions in the chat window.
I'm taking that.
Maybe we can do a rapid fire window where I quickly answer so that people can get their questions answered.
Sure. I'm actually going on to the window, right?
Okay.
So we'll do corporate governance, independent directors in the boardroom. There's a correlation, and that's why the law has allowed us to bring in independent directors. Don't you think it is working in the boardroom to uphold ethics?
Yeah, I mean, but the quality of independent directors is still not exceptionally high. I think in listed firms, independent directors are much more empowered than in private firms. So ultimately, it all depends on the shareholders. If the shareholders, as I said, the owners have to dictate the ethics North Star. In listed firms, there is definitely more control because independent directors cannot be incentivized. They are given fixed remuneration. Whereas in private firms, their remuneration could still be in stock options, which is determined by the value is determined by the commercial success. So it's still independent directors. It's still very toothless in private firms, but in public firms, there is some merit to it.
Great, thank you. The next question is, has Nephroplus conducted any Save Your Kidney kind of awareness programs for the benefit of underprivileged in the society as part of your CSR, if any?
Yeah, so we have done a campaign called Have a Heart for Your Kidneys. And we conducted this in many PHCs of Andhra Pradesh as part of our CSR activity, where we educated or at least tried to educate the PHC staff so that they can educate all the incoming population. We have done that there. We have done one in Uttarakhand, but there's so much more to do. It's about how do you invest heavily in this while keeping the price to the end patient, end guest at a medium level.
Great. Since you said it is rapid fire, I'm going rapidly forward into it. Is there any international framework or metrics to measure ethical leadership in healthcare sector?
No.
Yes, you mentioned
it's a very fuzzy. Yeah, it's a very fuzzy topic. There are many international metrics to measure commercial success, not ethical leadership. No.
Great. What are the sources of funding for a healthcare entrepreneur broadly?
All sorts of funding are open, right? Be it debt or private equity. It's in private equity, you can do angel round of funding, you can do venture capital funding, you can do large growth oriented private equity investors funding. The healthcare also has same source of capital like any other business. It's just that you need more patient investors. That's all. But there is no special source of funding for healthcare businesses. It's generic.
Right. Last two questions, sir. How do I open a scan center in a small town like Tenkasi in Tamil Nadu? What kind of knowledge I'm supposed to be equipped with?
Yeah, first question is, why do you want to open a scan center in that city, right? So if you're looking at pure commercial success, I can assure you that you might as well invest that time in something else, which you are aware of. But if you want to open, I think understanding the current, going and meeting the current scan provider in the vicinity, mapping out the market and figuring out where the gaps are, what kind of tests, what is the pricing that you need for that test, and talking to a manufacturer of that scan machine to provide you a pay-per-use commercial arrangement rather than a upfront purchase arrangement. So there's so many things that you can do. But firstly, why do you want to open a scan center? That's something you need to think very, very deeply.
Okay, great. One of our senior professors was joined from Tripura. We have a university in Tripura. We have actually 11 universities. Out of that, 5 are in Northeast: Meghalaya, Mizoram, Nagaland, Tripura, Sikkim. And our ICFAI University Tripura is a great hub. It attracts variety of students from the entire of Northeast. And then we have paramedical kind of healthcare programs run. And we find a great traction there. So the professor is saying, as part of the institute, can we attach with Nephroplus in some way, teaching the degree of dialysis care or the dialysis care tech?
Yeah.
I mean, please.
Sir, actually, we are giving the 4 years degree program, BSc in dialysis care technology, and which is very premier in the northeastern state. And I am giving the supply to the northeastern state, especially for the SKG Sanjeevan. I am basically from the community healthcare background, so I attach with different hospitals. But I need some more openings for my students in the dialysis center where we can send give the good exposure. That's why I write the question.
Sure, Dr. Mukherjee. We currently conduct, we have various branches of our training academies called NPDA, which conduct a 2-year program, not a 4-year program, because people are, again, as I said, impatient, right? Very quickly, they want the returns in 4 years. Having a degree, very few people are interested in that. So our maximum throughput comes from the 2-year program. And we now have a center in Guwahati, which is our first center in the Northeast. But I mean, Mr. Sudhakar can give you my email address, and we can explore setting up a training center jointly in Tripura as well.
And we have the faculties. We have the faculties.
Yes.
Fantastic.
Sounds good.
Thank you very much, sir, for that.
Okay.
One last question. This may be taken as one for the road. Professor Prasad is supposed to drive to the airport. So one last question on behalf of all of us. Sir, you have a great edge in terms of an intrinsic passion displayed by Kamal in your journey. Now, what about others? How do they select their partners? How do they select their associates in this journey of business into healthcare?
Yeah, I think the only thing I'll have to say is the chemistry matters a lot between the co-founders. And if you have a bunch of friends from college who are trying to do and whose resumes perfectly overlap, then you're not bringing complementary skills to the table. So if you can figure out other great individuals who can bring different skill set to the table, but you have to, co-founders need to have great chemistry. So many times I've seen startups where the co-founders dissipate after a couple of years, because startup journey is a roller coaster. There will be ups, there will be downs, there will be many downs, then ups. So unless the chemistry is great, the passion is great, it's very difficult. So it's like choosing a life partner. There is no magic sauce, but meeting a lot of people, talking about the purpose, talking about the reason why you want to do something. Initial conversation may not at all be related to the venture. Initial conversation could be very generic, but if you like somebody, you can maintain your Rolodex and reach out to them once you have a concrete idea and say, hey, what do you think about this idea? Rather than asking them to be a co-founder as a first step, you can just bounce the idea, and then if they get excited and you really like them, they like you, then pushing the concept of co-founder or joining the story could be interesting. But it's like finding the right life partner. It's very difficult. There is no magic sauce to it. You just have to meet so many people, talk to so many people, that hopefully you will find few good people that you can do the journey with.
Great. Mr. Vikram, I think you have very nicely put it. Finding an entrepreneurial partner is something like finding your life partner. Chemistry matters, and then it works in the long run. So thank you very much. And on this profound note, we will conclude this session, and we would like to thank you very much for answering all the questions with so much of patience and that therapeutic smile on your face. while answering each and every question. Very, very important takeaways are that unhinged capitalism is driving us towards this commercial interest and for profit, not just for profit, but the extremely disproportionate focus on profit and keeping the purpose in the back seat. I think that's where is the root cause, and there are no incentives for ethical actions or ethical leadership per se. Therefore, it is again a structurally lopsided situation out there as far as ethics and leadership is concerned. The moments of truth is an amplifier, both positively and negatively. If you do positive actions, everybody else in the organization would follow. You are a role model, but if you are unethical, that also gets amplified negatively, and the entire organization would easily slip into a slippery slope of unethical compromises every now and then. And there is no franchising at all in healthcare delivery. It's a very important value system that you have actually stated, and there are thousands of reasons for that not to franchise. And leaders in the business, especially in healthcare, will have to focus on overcoming the short-term pains for the long-term dividends. I think that relates to the purpose, that intrinsic passion, intrinsic passion which you mentioned. I think will only help us determine where we are going to go and stay this. It's a tough business, and ethics is all the more tougher, and it's a gray area, and we need to keep on learning from it and keep on dealing with it every day, every single activity that we take up. Thank you very much, sir, for this profound talk, this session, and the questions and answers that we have had. I would like to, on behalf of ICFAI Group, Professor Prasad, the Vice Chancellor, and everyone, and all the senior members, and also on behalf of all the participants, would like to profusely thank you for making this session a blockbuster session. We have learned a lot. We have enjoyed listening to you, talking to you, and I hope we will come back to you and we will do the tie-up with you for our ICFAI University Tripura. Thank you very much, sir, for your valuable time. I think your time should be spent on thinking about your guests. How many sessions are happening? How many dialysis sessions are happening without any noise? I think that's with the bigger purpose out there. So I will always be indebted to you for this valuable time that you have spent with us. Great learning for us. We'll come back to you. We'll write to you. We'll keep in touch with you. I'll also share the recording of this entire session, sir. Thank you very much. So, ladies and gentlemen, I would also like to thank you for making this a very, very interesting conversation because of the questions that you have shared and very actively that you have participated. I want to thank each one of you for your contribution. Also, we will meet you next Friday, 6:30 p.m. on 29th of October with Mr. Beswada Wilson. Beswada Wilson is a Raman Magsaysay awardee. He is the national convener of Safai Karamchari Andolan in this country. And I think we have some lessons in the social impact leadership that we will look at next week, Friday at the same time. Thank you all. Please take care, and we'll meet again at 6:30 p.m. Thank you all.